Welcome to Back from the Abyss. I'm Dr. Craig Heacock. As a social tribal species, one of our most critical attributes is the ability to form interpersonal bonds, to build trust, to listen, to connect, and to believe. We all tend to think that we can tell when someone is being open and honest with us, and when we are being deceived. And this belief emanates both from our body, our gut-level response, that involves feeling another's energy and relative level of sympathetic arousal, while unconsciously interpreting nonverbal cues such as microexpressions of the face. And this belief that we can detect truth comes from our conscious mind, our analytical, slow, logical, methodical system of thinking and mulling and remembering. When our gut or somatic response matches our conscious analytical assessment, then we tend to default to believing. But when they don't match, we shift to disbelieving. I recently watched the Netflix documentary Amanda Knox, which explored how and why she was convicted of a murder she didn't commit. Amanda wasn't believed because she didn't seem stricken or devastated enough by the murder of a roommate. She kissed her boyfriend passionately outside as the Italian police investigated the crime scene. She winked at her boyfriend in the courtroom. She smiled and giggled at the wrong times, and then even made up a false story at one point to try to deflect the brutal heat of the interrogation. In today's story, we hear Jeanine describe the awful consequences of not being believed. Not being believed about sexual trauma, not being believed about emerging psychotic symptoms, not being believed about being desperately suicidal for years. Jeanine and I explore the complex reasons why she wasn't believed. And one of these should be clear to all of you as you listen to this story. For Jeanine often has what we call in psychiatry, inappropriate affect. Jeanine describes awful things in a calm, even cheerful way, punctuated by nervous giggles. She speaks about pain in an unusually calm and factual manner. And like Amanda Knox, Jeanine was judged to be suspect, a false reporter, someone who just doesn't look or act as they should. But eventually Jeanine was believed, and then her healing could finally begin.
Well, from the outside, we've kind of had a perfect family. Married parents, one boy, one girl, dog. Typical. I lived in a pretty wealthy family. My dad was a politician, worked a lot, and my mom stayed home with us, I guess. But she was pretty absent. She'd go through mood swings and manias and depressions. So they got divorced when I was about 11. And I think they knew something was wrong with me because I was a little odd. Because I was suicidal as a little kid.
Wow, how little?
Well, probably starting at 8. But
was that trauma-based?
That was trauma-based. Yeah. Because the trauma started when I was my first memory was when I was 5, and that's when the PTSD started, I'm pretty sure. I had a pretty traumatic childhood, which is weird because from the outside it looked perfect. Mm-hmm. But my best friend died when I was little in a car accident, and so things you can't comprehend when you're little, but then you hear the story when you're older, and it's horrific.
Mm-hmm. And sexual trauma started young? Yeah,
about age 5 is my first memory of it. And that was by one person, and then that stopped. And then another person started, and then that stopped, and then my brother started molesting me and then eventually raping me hundreds of times. So,
And your parents had no idea?
No.
Yeah. Why do you think they missed that?
Well, they shouldn't have, because he was caught molesting somebody else. And they sent him to a therapist, and the therapist said it was normal sexual exploration for what he did to the other kid. And that's not true.
And did your parents know that you were getting suicidal as a little 8-year-old?
Well, I'd draw morbid pictures, of skeletons and people dying. And I'd leave I didn't want to be with my family. I'd leave Post-it notes all over the house saying, I'm running away. But they never really thought much of it.
Mm-hmm.
But
yeah. I mean, your mom, as you mentioned before, had pretty severe mental illness.
Yeah.
She was maybe just unable to really...
Right. Because when I was after my parents' divorce, we moved to a different house, my mom, my brother, and I. And she would just lay in bed all day, all day, all night, curtains drawn, just getting up to pee, or like having us go to her purse to get money for her because she couldn't cook, so we had to take care of ourselves. So
she's too ill to really follow what's happening with you, and Dad's absent.
Yeah. Because he was working like 80 hours a week when I was little. And then they divorced, and I rarely saw him the first couple of years. And then I eventually got kicked out when I was 14 over an Easter basket. And I moved in with my dad, and that's kind of how our relationship started.
And how did that progress? If by 8 years old you're starting to get suicidal, what did that start to look like in your teenage years?
I drank a lot of alcohol and smoked a lot of weed because it was my escape. Like, I was just suicidal all the time.
And did you try to reach out to anybody or ask for help or alert family or
about
people
the
at school
abuse?
what's happening?
Kind of. But the school, like, because my dad was pretty prominent in the city, like, when I did something wrong, I didn't hear about it. They just told my dad, and my dad would do nothing. Like, the school knew I was an alcoholic my senior year, and they told my dad, and he was like, oh, it's fine, she drinks at home. You know, kind of like a poo-poo everything, you know.
Do you remember what that felt like as a little girl, to have no one watching, no one really caring for you or protecting you?
Yeah. Well, and it's funny because now when I talk about it to family and friends now, like older friends, they're like, well, why didn't you tell us? Because we would have taken you in. Like, we would have loved to have you in our family. But
that's not how it works when you're 8 or 10
right.
or 11.
Because when I first tried to tell on my brother, I was 9. And I remember I was telling my friend about it, and she like just freaked out, and she's like, he's not supposed to do that. And then I thought I was doing something wrong. So that was the last time I ever tried to tell anyone, really. I felt like I was doing something wrong and letting it happen or whatever. But
I wonder, did you have so much trauma as a kid that it started to feel normal, or was there...
Oh, yeah, it was just normal.
That's just what
I
it
felt
was.
like when I was little, I felt like my whole purpose on earth was to be a victim, like to be abused. But, yeah.
That's so sad. So yet part of you is kind of falling apart, but another part of you is still actually doing well in school.
Oh, yeah. And I even had like untreated ADHD, and like I would not go to classes. I would spend most of my time roaming the halls and sitting. I never sat in my chair. Like, I couldn't sit still. So I'd like sit on the countertops or on top of the desk. And I was always in the hallway, and the resource officer was always getting mad at me, and I skipped a lot of classes, and it was just easy for me because I never had to study, and everything was just super easy. And then I got to college and was in for a big surprise. Yeah.
Do you remember, did you think that getting away to college would maybe fix things? You thought, I'll get out of Nebraska, get out of this town, get out of this family, and if I can finally just start my own life.
That's what me and my dad did. We moved out here because we wanted a fresh start. Because the head people in Nebraska knew what my brother had done and that kind of stuff. And my dad, I think, wanted to get away from it. He didn't want that stigma like attached to him. And I wanted to go to Boulder for school, so we just figured move out here and get in-state tuition after a year.
So you're coming out to Colorado, starting at CU Boulder as a freshman, and now your dad's actually has heard and accepted the fact that your brother was molesting you.
He at the beginning point when we were still in Colorado, it took him years to apologize to me for not believing me. But like when we first moved out here, he still thought it was just consensual between me and my... I'm like, no.
Oh, that's awful. The end of adolescence is usually a time of hope and excitement, a time to leave the nest and start the grand adventure of life. Yet this is also right when people typically have their first episode of psychosis, often between the ages of 18 and 21. With both schizophrenia and some types of schizoaffective disorder, the late teenage years are marked by an excessive autoimmune pruning of the synapses of the brain, and this leads to a type of global short-circuiting, which manifests as illogical and delusional thinking. Psychosis classically begins with paranoia, and this was true with Jeanine. Paranoia develops due to an overactivity in one of the dopamine circuits of the brain, the saliency circuit. Dopamine surges through the saliency circuit when something crucially important happens, often something related to safety or survival. With the early stages of paranoia, excessive releases of dopamine cause people to start to attach profound importance to specific people or places or things. In Jeanine's case, her history of childhood sexual abuse shaped how the first glimmers of paranoia emerged.
The very first instance at my dorm room was horrible because my roommate was bad. She was making fun of people who take psych meds and how they're crazy and all these things. And my soon-to-be best friend came in when she was saying that. And we were both silent. And we went into my friend's room and she turned to me and she's like, I take antidepressants. And I'm like, me too. And we became best friends after that. Mm. We're still friends now. I work for her now, so.
Mm. Well, that was a fortuitous pairing that you got to be with her.
Uh-huh. Mm-hmm. Summer after my freshman year was the first time I was hospitalized. So I was 19, maybe 20. It was right after my birthday, I think. And then that summer, it never got better. Sophomore year was horrible. That's when all the real psychosis started and stuff like that. Mm-hmm. And I thought it was slow, but maybe it was fast. It's just I don't comprehend some of the stuff that happened.
Yeah, trying to think back the way a manic episode or a psychotic episode unfolds is, as most people describe, very kind of patchy and dreamy, and the timelines are very strange and muddled.
Yeah.
Yeah. But what were your earliest memories that maybe something was really changing around you? Well,
I didn't know at the time, but as I look back, I think it was just the paranoia started, and I think it was fueled by my trauma. Because the first psychosis that I really went through, I think, was cameras. And I thought there was cameras everywhere watching me. Because I was pretty much like a porn star when I was a kid. So I don't like cameras.
So you were filmed as part of your abuse as a child.
Yeah.
So when that first started in the dorm, the first paranoid delusions involved being filmed.
Yeah. Mm-hmm. I didn't want to go to the bathroom anymore. I'd check all the drawers and I'd check everywhere I could find. And I stopped showering because I didn't want anyone to see me. You know what I mean? Mm-hmm. So then I stopped taking care of myself, hygiene wise. And then after that kicked in was the shadow people. And so then I didn't even leave my dorm room. That's how my grades went downhill really quick. Mm-hmm.
Did you feel you were in danger of being killed or more followed and monitored? Or what?
Followed and monitored. Mm-hmm. I didn't think I was going to be killed. I just was terrified of him.
Yeah.
Well, then I started thinking everything was poisoned, my pills were. Because they had put me on a ton of pills that summer at West Pines or something. I don't even remember what it was. I thought they were poisoned, my psych meds, so I stopped taking them. And that didn't help things. And that's when things really got out of control. And a couple weeks later, I tried to kill myself again. Mm-hmm. And I did a much better job at it. Because I almost succeeded, but it's it was almost like I'm practicing, is what it felt like. Because of all the time I've tried to kill myself. Yeah. It's I'm trying to get better.
Do you remember, was that attempt fueled by trauma or was that more fueled by the fear of psychosis? Yeah. Were you hearing voices as well?
Yeah.
Yeah. What was that?
And I was smelling things that weren't really there. The olfactory hallucinations and tactile hallucinations. I'd feel spiders crawling on me and yeah.
That sounds horrifying.
Yeah.
And again, as you've described before we started recording, that you didn't know, there wasn't a part of you thinking, oh, this is a hallucination or this isn't real.
Not then.
It was fully 1,000% real.
Oh, yeah.
Yeah. And nobody knew.
Right. Mm-hmm. They just thought I was spoiled. That was the big theme, was I was a spoiled brat who wanted attention. I'm who would make this stuff up? Why would I want to be crazy? Why would I want psychosis? I don't understand.
Wow. Yeah, looking back, why do you have any theories why you weren't believed or why you were labeled as a kind of being hysterical or
I don't like my
spoiled?
parents didn't believe me, and then it just kept going on. Like my dad had a lot to do with it, I think, because he would tell them there's nothing wrong with me. Like he'd be like, "Oh no, she can't hallucinate. She's never hallucinated." Like I don't think my dad believes I've ever hallucinated. When my friend saved me that one attempt, and she called my dad at 2 a.m. in the morning, and he was like, "Just call me if she dies." Like that was his concern over me. And he never visited me in the hospital or anything.
Just call me if she dies.
That's what he told her.
Because he thought this was you being a sort of crying wolf and making a big deal out of nothing and wanting to be the center of attention.
Yep.
Yeah.
Which was funny because when I was a kid, I was so like quiet. Like I was not the center of attention.
And I wonder if, we can never know exactly what's going through someone's mind, but if your dad was sort of oscillating between my daughter, is this sort of exaggerating, attention-seeking, histrionic, or B, she has really terrible mental illness, and that the reality of number two, that option was so horrible, like he just couldn't even go there, that he had to sort of fully endorse this idea that, oh, my daughter's just making step up for attention.
Yeah. Well, and like the mental health field agreed with it.
One of the many factors that complicate psychiatric diagnosis is that people tend to revert to their most regressed and unhealthy personality styles when they get sick. Although Jeanine doesn't specifically discuss this, when she was in and out of all those hospitals years ago, she was also given a borderline personality diagnosis. And this is a common thing with complex PTSD. Trauma leads to deeply disordered attachments, chronic self-harm, suicidality, and a borderline personality structure. My hunch is that many of the clinicians whom she encountered in those days saw her primarily through the borderline lens, which was consistent with her inappropriate affect and chronic treatment resistance, and they wrote her off as histrionic, as a liar, or malingerer.
In the beginning, like I went to the state hospital, which was horrible. And the social worker there told my dad I was a spoiled brat and he needed to take away all my car and all this stuff and how he needed to kick me out and let me live on my own. And I'm like, who says that? Like, they just did not believe me at all. And I was still hallucinating. I hallucinated until what, like 2007? About 2007. So I hallucinated for like 7 years.
Yeah. I wonder, again, I didn't know you then, but I wonder if part of it also could have been, in general, you have a pretty friendly, easygoing way about you. Like you're kind of gentle and smiling. And I wonder if back then maybe you had still some of that kind of learned, put on a smiling face and look okay.
I had a flat affect for a long time. Or an inappropriate affect. Like, when I was sad, I would smile. Or, like, I just wouldn't do anything at all. But I think I was pretty good at faking things. Trying to fake it, make it better,
It's almost like they didn't think you looked, quote-unquote, crazy enough.
Exactly, yeah.
With the inappropriate affect, maybe you were smiling as you were telling them about horrific auditory command hallucinations, and they're thinking, oh, what is this? She's making this up.
Yeah, because you don't think much about it when you're actually hallucinating or you're in psychosis. I look back and reflect, and that's how I can figure out what was going on, you know what I mean? But when it's actually happening, it's hard to tell the difference between reality and a hallucination.
Yeah. Do you remember how would you try to find some temporary measure of safety during those times when you're feeling like there are these shadow creatures and you're being filmed and you're hearing voices? I mean, how did you, or were you able to find any way to bring yourself some sense of peace or, I don't know, just respite from this onslaught of terror.
No, I think that's why I was in the hospital so much. But
there's no relief.
Because there was lots of hospitals.
Yeah.
I think 8 different hospitals, 40 different visits, or 40 different hospitalizations.
40 hospitalizations.
So if you think about it, that's like over a year in hospital. Like if you push them all together.
When do you remember starting to be believed?
I met, when I was at the Peaks, I met a nurse practitioner, and she believed me. She put me on clozapine. She was great. She saved my life, I think. Because everyone told me no, or they told her that I was a lost cause, because they had tried over 30 different medications and nothing worked. And she was finally like, told me about Clozaril, how it's like kind of the last ditch medication, but it works great. It's just a pain getting blood draws, but like that's what calmed the hallucinations.
Yeah.
But I started seeing a new therapist, and I've seen her for 10 years. Yeah, 10 years. And she believed me too. And like some of the stuff that happened to me was so crazy and so traumatic and scary. And she made me, like, I thought maybe it was all in my head. Because like how does that happen? Like who lets that happen to a little kid, you know? But it was real.
Yeah. Gosh, it seems like foundational part of healing and therapy is being believed.
Yeah.
I mean, we just kind of assume that if we come with something hard to a therapist or a doctor that we're going to be believed, but you have the experience of being discounted and shamed and finger pointed and really ignored for a long, long time. Have you come to some sort of peace with your father around that? Because you described he was a major part of sort of, if you will, kind of poisoning the well with the people who were trying to help you.
Well, my dad's changed a lot. Like, I don't know if it's because he came out of the closet or he's just more comfortable in the Denver area, but he like started hugging me. Like, he never hugged me as a kid, like ever. And like, he hugs me all the time now. He's more open, and he wrote me a letter saying how he was sorry how he reacted with me and my brother and how he understands that it was my brother's fault. That was a while ago, but so he's gotten better, but he still doesn't get it.
Do you feel like you've been able to come to some level of, I don't know if forgiveness is the right word, acceptance or some kind of peace with all those years that he didn't believe you and
and he left me alone with a crazy woman.
Yeah.
I'm pretty much at peace with it. Like, if I put myself in his shoes, I can kind of understand what he's feeling. Like, who wants your kids to know your son is raping your daughter? Like, who wants to know that? I feel like I'm still very suicidal. Like,
about that for so many years that's kind of a go-to.
it's like an easy out, kind of, in my opinion. But then I'm also, the good thing is I also am kind of negative and like, oh, I can't do it that way because I'll end up brain dead or I'll end up paralyzed or I'll end up blind, So I always have an excuse not to do it. Because I know every time I've tried to kill myself, it never works. So it's kind of like, I'm pretty sure I'm not. Yeah.
Yeah. Well, for years, you had many, many, many attempts, and some of them were near fatal. Mm-hmm. And when was your last serious suicide attempt?
November 2010.
Wow, 10 years.
Mm-hmm.
So something shifted.
Mm-hmm.
Yeah. How do you explain that you had so many hospitalizations? And you had ECT as well, is that right?
Yeah, 22 of them.
You had 22 electroconvulsive therapy treatments. You were in the state hospital, over 40 hospitalizations, many, many suicides, some near fatal. And now 10 years, no. You said you still struggle even daily with some suicidal thinking, but no serious attempts in a decade.
Correct.
Yeah.
No self-injury in a decade.
Yeah. How do you explain that?
I think it's more of being believed. That I have a great team, like a psychiatrist and a therapist. And I don't know, since I've started seeing them, I don't know if it's being believed or what. But with my therapist, I'm working on dissociation because I dissociate a lot. But it's getting better, and I think that's helping me heal by dealing with the dissociation. I love educating people. It's weird, but I love talking about mental illness. Like, I think people need to know about it. It needs to be out there. Like, I've talked to high school classes and my friends' high school classes, and the kids love it. And then they're like, when I would leave my friend's class, the kids would be like, well, you don't look crazy. And I'm like, it's crazy. Have a look. But like the kids love my stories, and it's just kids will come up and talk to me afterwards and be like, "Oh, my friend has this," and and it's just like I want to educate people and help people, and just get the word out there. Mm-hmm. I work part-time, very part-time, but I work part-time. I volunteer. I write. I do everything. It's just I know my limits now. Mm-hmm. And once I pass over those limits, everything goes out of control. So,
yeah, what kind of limits have you learned that you need to be careful about?
I can't work full time. Like every time I've tried, every time I've done, I have a degree in social work, and for my internship, I was supposed to do full time because that's just what they offer, and I ended up having to I was sick for 7-10 days because I was so suicidal and so depressed and so out of control. So I can't do full time. I just get too unorganized. I get too suicidal. I get too depressed. And that's happened every time I've tried to work full time. But same with school. It took me 15 years to finally graduate. Mm. But I did get my degree, so that's nice.
And there's such pressure, I think, spoken and unspoken pressure to go to school full-time if you're in school, or work full-time. Mm-hmm. I think people can sometimes feel self-conscious if they're working part-time, because the question might be, oh, well, are you looking for full-time, or when will it become full-time? Mm-hmm. Or I think in American society that can take people, I've seen that with my patients, take years, many years to fully accept that part-time work is not only okay, it's imperative. Mm-hmm. That full-time work is just too much.
Yeah. Well, and I have a great job, and I love the kids I work with, so mm-hmm. It makes it easy. But even then, I couldn't do it full-time, even if it was with the same kids, because I'm a nanny, and even with those same kids, I couldn't do it full-time. Mm-hmm. But I have a dog, and my dog's great. He knows when I'm sad, and he'll jump on me and cuddle with me, but really, what keeps me going is the kids I work with. I don't know, they keep me going. Just knowing that there's someone relying on me. Even my dog. What would happen if I died? Like my dad would take him, but he would miss me. Poor thing whines every time I leave the house, like, and like, what would the girls do if I like tried to, like, if I committed suicide? Like, those girls would be devastated. And they're at an age when they would like, they know what's going on. So like a suicide would like really upset them.
Yeah. I wonder when I think about you a decade and more ago when you were so suicidal, so many attempts versus now, I wonder if there's a number of things that have changed, including your medication clozapine relationship with your dad. But if one of the big things grounding you, keeping you from killing yourself is just what you said, these connections, feeling like you matter, like people would miss you.
Right. Because in the beginning, I never thought like that. I was always like, no one wants me around. Like, I'm around just to be a punching bag, basically. So that was one of the reasons I was always trying to kill myself, was because why not? Like, my life was so painful. Like,
like you were kind of a burden. You were not really meaningfully connected to anything or anyone. So better to just disappear. Yeah. Whereas now, there'd be a huge amount of loss because you're connected to some people deeply.
but I know I was very lucky because I should have been on the streets. Because, you see a homeless person and my dad will be like, oh, they're just lazy. I'm like, no, that could have been me. But I came from a wealthy family with connections, and so I got all the treatment.
Yeah. I know that is a really scary thought, that if you hadn't had the financial backstop of your dad, because he wasn't much of an emotional backstop for a long time, but he could at least keep you from being homeless or dead.
Well, and if it was like 40 hospitalizations, so let's say like 365 days, $100 a day.
But
that's a lot of money.
$1,000 a day.
Yeah, $1,000.
Yeah. Right.
Well, the insurance covered it except for $100.
Oh, okay.
There was $100 copay.
Yeah.
But still, that's like thousands of dollars.
Yeah.
That he had to pay. And like when I went to the eating disorder clinic, he wouldn't pay the copay. He was like, there's nothing wrong with you, you're fat. I'm like, that's not the deal. It's the fact that I'm like vomiting every time I eat. No, you're fat, doesn't matter. But yeah, so I had to pay for my own eating disorder treatment.
Yeah. Do you think this has opened your dad's mind that actually mental illness does exist, and that there are people out there that are suffering terribly that are not just, making it up or need to?
He has friends who are psychologists too. And I think that's helped him to understand me more, because he was just so impatient. And I think his friends have talked to him. Mm-hmm. But I'll meet other families and how their children are destroying their lives. They're so psychotic and they're so out of control. And I'll be like, it gets better. That's how I was. My dad hated it, but I have decades later, I'm finally stable. So there's hope, especially for people with kids who are psychotic and they don't know what to do with them. Kids who are threatening to kill them every day. And they have nothing to do. And I'm give them on clozapine and then...
Yeah, and help them find someone who will believe them and connect with them. And yeah. But right, that's a hard journey. I think we're gonna do an episode here soon about the difficult path of finding the right therapist. Because boy, for so many people, that is a brutal journey. Didn't you say you had a psychiatrist suggest to you that if you were gonna kill yourself, you should use a certain med?
At the state hospital. No, not state hospital. At one of the psych hospitals. I had tried to kill myself. And then they hospitalized me. And he's like, oh, if you really want to die, you should take this. And I was like, okay. And then 8 months later, I did what he said, but I stopped before I finished. Because my cousin called me and was like, oh, I love you and all this. And I was like, oh, maybe someone does care. And I went to the hospital and they didn't think it was a big deal, because most people don't overdose on it because it's a pill for elderly people usually. And so young people don't overdose on it. So they didn't know how bad it was until they got the numbers from my lab results. And the doctor there in the ER when I went in was like, "You're wasting my time and the taxpayers' money." And I was like, "Okay, I just took these pills." And then he was like, "Oh." And he didn't believe me until the labs came back. And then like I had to have fresh frozen plasma and infusions and stuff. And then I did it again on the same pills a year later. And that time I almost died. At one point they said, "You're going to die and there's nothing we can do about it." When I was in the ICU.
Did it feel like when that psychiatrist said you should use this particular medication to kill yourself that you were a hopeless case? That he was maybe out of his kind of unconscious sadistic countertransference? He was...
I don't think he thought I would do it. And I'm like, okay.
Yeah. But again, it seems like the unspoken message there is there's nothing we can do for you. Like maybe you should just
finish it
and finish this, right? Because you keep rotating in and out of the hospital, and there's no hope for you. Yeah, that's so sad. Or it sounds also to me like he was not well managing the complicated emotions that come up when you're working with somebody who's really suicidal and keeps being suicidal. Because for a therapist or doctor, that's really scary and can get frustrating, can even bring up the therapist or doctor's own anger. Like, why do you keep doing this? Like, why are you locked in this suicidal cycle? And it's almost like a Freudian slip on his part. Like, I don't even know. I'm guessing it wasn't even necessarily super conscious. Did he just put that out there as
he was new too, so I had never seen him before. And he didn't know. I had 2 huge charts at the hospital. So I'd been to that hospital like 27 times. And I think he was just like, "Oh, she's just attention seeking or something." And so I think he told me because he didn't think I'd do it.
I'm glad you survived. I'm really grateful that you came to tell the story. And this is a brave and vulnerable and I hope really hopeful, helpful thing for people to hear, because you have been through it and you're still in it, but you just have a measure of kind of peace and acceptance and definitely connection that sounds like you didn't have for a long, long, long time.